Neurodevelopment refers to the growth and maturation of the nervous system and brain. There are 5 stages of neurodevelopment, and they include neuroplate induction, which is a key developmental structure that serves as the basis for the nervous system; neuroproliferation, which is the generation of new cells; migration and aggression, which is slow movement of the right plate and structural formation; axon growth and synapse formation, which is when axons and dendrites begin to grow to their mature size and shape, and form synapses with other neurons or tissue, a process known as synaptogenesis; cell death and synapse rearrangement. Between 40 to 75% neurons made will die after migration. Death is normal and necessary. Neurons die due to the failure to compete for chemicals provided by targets. Any impairment of growth and development of the brain or spinal cord can contribute to a neurodevelopment disorder. The 2 major disorders of neurodevelopment include autism and Williams syndrome. Autism is a complex neurodevelopmental disorder. Despite considerable between-patient variations in symptoms, 3 are considered core symptoms of the disorder. The first, a reduced ability to interpret the emotions and intentions of others. The second, a reduced capacity for social interaction and communication. And the third, a preoccupation with a single subject or activity. Other characteristics of autism include 80% of the disorder are male, 50% suffer from mental retardation, and 35% have seizures. Williams syndrome is a genetic condition that is present at birth and can affect anyone. It is characterized by medical problems including cardiovascular disease, developmental delays, and learning disabilities. These occur side by side with striking verbal abilities, highly social personalities, and an affinity for music. Characteristics include characteristic facial appearance, which is widely spread teeth, a long philtrum and flat nasal bridge; excessive social personality, they are usually overly friendly; developmental delay, learning disabilities, and attention deficit disorder; heart and blood vessel problems; hypercalcemia, which is elevated blood calcium levels; feeding problems during infancy; and hyperacusis, which is sensitive hearing. Our case study is a case study of the development of an infant with autism from birth to 2 years age. This was published in May 2000 by Journal of Applied Psychology. This report describes a case study of the development of an infant with autism who was observed closely by professionals from birth, and to whom a comprehensive psychological evaluation was administered at approximately 1 to 2 years of age. During the first 6 months of life, this infant displayed difficulties in oral motor coordination and muscle tone that fluctuated between hypertonia and hypotonia. He started easily, had poor state regulation, and was hypersensitive to touch. Notably, however, during the first 6 months, the infant vocalized and responded socially to others by smiling and cooing. During the second half of his first year, he continued to demonstrate diffuse sensorimotor difficulties and diminished oral motor control. Hypersensitivity now extended to a wider range of stimuli. He had problems in sleep regulation. Motor stereotypes, including rocking head and banging and toe walking, were observed. Difficulties in the domain of social interaction began to emerge during the second 6 months, including poor eye contact, failure to engage in intimate games, and lack of intimate vocal responses. By a little over 1 year old, the infant met diagnostic criterion for autism based on the Autism Diagnostic Interviewer. There were several domains in which this toddler in autism did not show impairments. In the areas of immediate memory for actions, working memory, response inhibition, and speech perception, this 1 year old with autism displayed no evidence of significant impairment on the test administered. This case study offers clues regarding the nature of autism at its earliest stages. Understanding why early development in autism will be important for developing early screening and diagnostic tools.